All right. Hi, everyone. Thanks for joining today's webinar. Today, we'd like to introduce longitudinal aging study in India, Diagnostic Assessment of Dementia, which is called LASI-DAD. So myself, Jin Lee, and lead programmer Sandy Chen will give you an overview of the study and followed by specifics about how to download the data and play with them. So thanks very much for joining us. And along the way, if you have any questions, please send us a text. Then we're trying to answer as they come in. All right. So what I plan to do is just give you a brief update about the study itself and introducing how the sampling strategy is done and overview of the project protocol. And then we can go into specifics about how to download the data and some of the data structures and additional information that you can obtain. So LASI-DAD is conceptualized as an in-depth study of late life and cognition and dementia. We started as a hospital-based study, trying to partner with several geriatric hospitals in India, and they are the important co-eyes of the study who oversee the data collection effort. And then we quickly realized that India is predominantly still rural society, and in order to have more representative study, we need to go after the population residing further away from the hospital. So eventually we grow to become a more national representative study by identifying the respondents and interviewing them who reside far away from the hospitals. So our field team actually traveled long distances to remote villages and interviewing older adults residing in the community. Our sample size is about a little bit over 4,000. And we recruited our sample from the main study, which is Longitudinal Aging Study in India, which I will shortly introduce. All our respondents are at age 60 and older. And we administered the HCAP protocol, which is Harmonized Cognitive Aging Project Protocol developed by HRS team. For the purpose of international study of dementia and late life cognition, HCAP study protocol has been adopted by multiple countries around the world, including India. However, we have to modify the protocol to make it suitable for our population. So I will tell you more about exactly how we modify the protocol today. So let me first introduce the LASI study a little bit. LASI is an ongoing cohort study of older adults in India. This is a sister study to the US Health and Retirement Study. We, back in 2010, we did a pilot study in 4 states, developed the protocol, and then we launched the study first as a national study to represent like 90% of the population. But everybody, including us, got too excited, and we actually obtained additional funding from government of India, and the study has grown dramatically. Originally, we planned to recruit about 18,000 older adults in India, but we ended up recruiting more than 70,000 older adults in India from every state and union territories of the country. We sampled based upon the 2011 census and identified the older adults at age 45 and older. And we interviewed both all the age qualifying older adults and their spouses, regardless of ages. And we oversampled those people who are at age 60 and older. and also oversampled 4 metropolitan areas of India. So when we first started the LASI-DAD about 4 years ago, at that time, original plan is to recruit the sample from like 14 different states from India, and that's our first phase 1 and 2 studies. But as we further progress on the project, we realized that there are incredible variations across the country. So it is very important to not only get the rural representation, but also geographic representation. So we were very fortunate to receive additional funding and to go after additional 6 states. So we are still in the field as of today to go after those additional states. Another thing to note here is because we originally planned first phase 1 and 2 studies, we actually already released the data because data collection itself takes time, and we just didn't want to wait until we complete the phase 3 data collection to release the data. So what's available currently now is first 2 phases of data, and once we complete the data collection, we plan to release the entire study project later on this year. Another thing to note is that the original LASI study was fielded in 3 phases. Because of the linguistic barriers, what we have done is we trained the trainers in English, and each of the training team came from each state of India, go back to their own state, and then train the interviewers in local languages. Because of the administrative and linguistic reasons, we unfolded the fieldwork in 3 phases, and we follow that approach in DAD, and going after interviewing respondents mostly about 6 to 7 months after the original main study interview. We followed up and conducted the interview afterwards. So our fieldwork is in that phased approach. And by the end of the conclusion of phase 3 data collection, we will be able to represent about 92% of the population in India. So our sampling strategy has been very purposeful. We used the 2-stage stratified random sampling strategy to make sure we have enough number of respondents with cognitive impairment risk. So what we have done is we stratified the entire LASI sample based upon the risk of cognitive impairment and their state of residence. And then we randomly draw the sample with about equal number of high risk and low risk of cognitive impairment. Our response rate is about 83%, and the first 2 phases of sample is about 3,200. So how we determine the cognitive impairment risk? That's based upon the cognitive test performance during the main LASI study. And for the cases where the respondents failed to participate in the cognitive test, then we administer the proxy cognition module. Basically, household members who knows about the respondents were asked with some additional questions about the respondents' cognitive status. We used the Jones IQ code test. So our when we are trying to identify the risk of cognitive impairment, we based our judgment based upon their total cognition scores. And then we look at both memory domain specific performance and non-memory domain specific performance. So to reiterate, we divided total cognition score in 3 groups, but when we do that, we did that relative to their age and education group, because the age is most important risk factor of cognitive performance in later life, and also the illiteracy is quite high in the country. So what we have done is we grouped based upon age and education and identified their relative cognitive performance. And then, as I noted earlier, we looked at the memory domain and identified bottom 15th percentile and another bottom 15th percentile based upon the cognition score. And we have also paid particular attention to missingness in cognitive test scores, because missingness in when you administer cognitive tests is not random. It's actually quite highly associated with the people's cognitive status. So we identified the top 15 percentile of people who said don't know or who refused to participate in cognitive tests. And then we look at, for the cases where respondents did not complete the cognitive test, we look at their proxy cognition score and identify their impairment risk. So these are the tables showing you the response rate. Basically, you can see the people who are highly educated people who lives urban area tend to be less cooperating, so our response rate is lower in urban, highly educated area, but still quite high, and it is about 83% response rate is quite consistent with other age gap studies. This slide is actually showing you a set of cognitive tests we administered for LASI-DAD study, and the red font signals the modification from the original HCAP protocol. For all the HCAP protocol use mini mental state exam, and for India, we utilize the Hindi version of mini mental state exam, which is suitable for illiterate population. And we have also administered the symbol cancellations test instead of letter cancellation because of the illiteracy issues, and symbol cancellation is actually also utilized other HCAP studies such as MaxCog, which is MHAS's HCAP protocol. And we have introduced a couple of 5 new tests in our study protocol, which include hand sequencing and token tests to measure executive functioning. We brought in the judgment and similarities and differences tests from the CDR. We introduced the go-no-go test as an attention test, but we dropped the backward counting test because that test was not very practical because of the high innumeracy rate in the country. And HCAP study administered the digit span backward test only, but we administered the both digit span forward then backward. Informal report is exactly same as HRS HCAP protocol. We made a modification in terms of the question context. Some of the activities that would be more suitable in India, bring them in, like doing yoga and other activities, and eliminated some of the activities that doesn't seem to be relevant within the country context. One of the unique things that we have done is we obtained clinical diagnosis for each of the DAD respondents utilizing online platform. So what we have done is we actually uploaded all our data, both from cognitive test data as well as informal report on a website, and we bring in clinicians, both geriatricians and neuropsychologists and psychiatrists, and clinicians review each of the cases and provided the CDR rating for each case. And when there is a consistency, then that score is good as it is. When we found clinicians don't agree with each other with their initial rating, then we organize online consensus diagnosis meeting virtual meeting, and then evaluated each case and provide CDR rating for our respondents. Because we developed this CDR consensus website during the phase 1 fieldwork, we only completed the CDR for phase 2 and phase 3 data collection. But we developed the algorithmic model to predict the dementia status for phase 1 sample, and we plan to release that predictive scores later in the year once we complete the study. Another unique features of the LASI-DAD compared with other age gap study is actually it's very rich covariates. So we have administered the anthropometrics and collecting blood pressure and administered many performance tests and collected many nutritional assessment. We also collected a rich venous blood, and all our venous blood specimens were collected by phlebotomist and then processed within 48 hours. And we also released this venous blood based markers for researchers to looking into potentially biological pathways. As I noted earlier, we released the data last year, first phase 1 and 2 data, and we are currently in the field and plan to complete in mid-April. And once we are done with the field work and imputation of missing variables and prediction of those CDR cases, then we plan to release the data later this year. And I introduced the sampling strategy as well as the protocol. Actual study protocol is already published, so you can get the detailed information and citation of each of the cognitive tests we used from the BMJ open paper. We also just got accepted of our very in-depth paper discussing all the methodological considerations that we have given, evaluating illiteracy, numeracy, and other details will be coming out from the biodemography and social epidemiology journal soon. And also our paper on online clinical consensus diagnosis post-process and the validation study demonstrating that it is actually valid, providing consistent results with the in-person doctor diagnosis from Journal of American Geriatric Society. So those are coming soon, and I will pass it to Ms. Sandy Chen to discuss the data download.
Hi, everyone. So now I'm going to show you how to access the data set. So first, you will need to go to our project website, LASI-DAD.org. This is our LASI project website. On this website, you can find the information about the study design, news and event, our research team, and the data download. On the top right corner, you can find the data tab. After click the data tab, you will see the data download page. As Junko mentioned, the current data only contain the phase 1 and phase 2 data only. We are still collecting the phase 3 data and will be available later this year. So there are 2 data packages we are releasing right now. One is for the raw data and one is for the harmonized data. Harmonized data is a user-friendly data file that contains the summary measures that are comparable across studies. So I will talk about that more in detail later. In the raw data package, there are 4 sets of the data: condition test, informant report, geriatry assessment, and broad assay. For the first 3 data files, the code book that contains the summary statistics will be in the data package. For the broad assay, a document describes a protocol and detailed information about each assay is in the package too. For the harmonized data package, it includes harmonized data, the codebook, and data creation code. I will show you the codebook example in the later slide. On the bottom of the data download page, you can find the instruction about how to access the data file. There are 3 steps. First, you need to apply, and then we will approve, and then you can download. First, you need to create an account on the Gateway to Global Aging website. This is a website that deposits the information about aging study for more than 30 different countries. Then you need to download and fill out the user agreement. After you complete the form, you will submit the form using the link on the step 3. After you submit it, our team will review your request and verify the information. Within a few days, you will receive an approval email that notifies you that your request has been approved. Once approved, you can log into Gateway website and download the data. This is the main page for the Gateway website. The registration is on the top right corner, and then after you register, you can click the download tab to download the data. On the download page, we provide 4 sets of the data: the core interview data, live data, live history, and the HCAP Harmonized Cognitive Assessment Protocol. You will click the HCAP tab for the LASI-DAD data. Currently, as you can see, we are working on 3 HCAP studies: LASI-DAD for India, HIS HCAP for US study from HIS, MESCA for Mexican study from MHIS. For the HIS HCAP and MESCA, the raw data is available on the study website. You can click the link for the study detail for more information. The harmonized data set for other 2 studies will be available later this year. So after you click the download, again, there are 2 sets of data packages are available for you to use. So what is harmonized data files? This is a user-friendly file that contains the summary measures that are comparable across different studies. The variables are defined as similar as possible to across the study. We use the country-specific variable name if the variable contains the different response scale or definition. For example, R1 EDUC_L, L indicate LASI-DAD. This education variable has different response scale from other education study. So the user will know this will be a little bit different from other educational variables. So here are the examples for harmonized codebook. We include a brief overview of statistics for each variable. It lists out the variable name. In this example, these are the variables for day naming. It shows the descriptive statistics too. If the variables are categorical, it shows the frequency table. We also explain how we construct the variable and how we define and the assumption we use to create this constructed variable. So you can look into all the text, and then we carefully prepare the text for you to reference to that variable. We highlight any difference with other study. So here we list out the difference with HIS HCAP. We also list out the difference with the harmonized LASI, the main study. We list out all the variables from the raw data used in the creation of the variable. If users want to create their own summary measure, they can refer to this list. So these will be coming soon. We are currently, as I mentioned before, we are currently working on 2 other studies, and the harmonized data will be available later this year. We also working on a crosswalk comparison table. This table will help the researcher to identify the difference across all the different studies and then we highlight all the difference, and then the protocol, the different protocol used for collect the data. And then we are also currently working on putting the metadata information on the Gateway website. That's the information from the questionnaire and can be used in the search engine we provide on the Gateway website. Last, we will release the complete data set for LASI-DAD, including the phase 3 data later this year. So this concludes our today's webinar, and now it's open for questions. Again, today's slides and video will be available on the Gateway website within 24 hours. So we got one question, result from the broad test back. So yeah, for the broad assay, in the raw data package, we do include the broad assay data. Are there any other questions? If you have a question, please type in the question box. Oh, yes. So, so there's one user asking whether the respondent will get their broad result. The answer is yes, part of, because we prepare, after the lab result, we receive the lab result, we will prepare a health report. So on the report, we including all the basic geriatric assessment and then the 5 biomarker, 5 assay in there, the basic one. So they do receive the report. Yeah, so user is asking which assay that is on the health report. I don't have that in right now, but if you email your question to our help, email the help@lasi-dad.org, I was able to let you know what are 5 markers we include on the health report.
So there is a question about the weight. We have constructed a weight to make our sample to be representative of the population. So weight variable is already created and available. Information on how weight was constructed can be found in the BMJ open paper. And that weight is supposed to make our sample representative of the entire country. And when we release the updated data later this year, we will construct the weight again, and that will be representative of the country again. So we have a question about indigenous population. We do have information about people's respondents' caste and whether they are from particular tribes and different groups. And that information is actually available from the main LASI data, and that's possible. But what will be released in the public is including just information based upon groups, like a scheduled caste, scheduled tribes, and people without any caste, and also other backward groups. the self-reported information on regarding the cast is currently being reviewed, but because it's typed information, a lot of data cleaning is required, and we are also debating a little bit in terms of to what extent we'll make the data available to the public. So please wait a little bit until we sort out exactly how we can make this data available to you guys.
Oh, there's a user asking what's the difference between downloading the data from the gateway website or the LASI-DAD site. Actually, the data can only download from the gateway website. So it will be the same data set since we only allow the download site to be on the gateway.
So you got redirected once you click the LASI-DAD website, then you will automatically move to the gateway website. So we have a question about left behind aged. So it is not very clear to me what you mean by left behind aged. So if you can elaborate on that, I will try to answer that. Okay, so we have some explanations. The user who's interested in the left behind is actually talking about the living arrangement of the older adults. So we do have information about these older adults' living arrangement, who they are co-residing with, and whether they have any children or other family member who live where they are living, whether they live with them or they live in long distance. If in long distance, whether they are living in another state or in another country. So those kind of information is available. Yes. So there is a question about blood report. So we provide the blood report, as Sandy mentioned earlier, as more of an incentive to the respondents. And we are not providing a comprehensive blood report because, you know, sometimes information can be overloaded, and without providing detailed information, respondents may have a hard time to understand what that means. And also there is a time interval for them to receive the blood report. And we usually provide a blood report after the interview, after blood report is generated, and we send them to the respondents. You have to understand that many of the respondents in India don't have mailing address, and they actually, we go to the field and they live in rural communities. So with the map and GPS information, we can identify where they live. But sending a mail to those areas is quite challenging. So as some of the urban areas as well. So in those cases, we actually send the field team back to the field and giving the blood report to the respondents. And in terms of when we give the blood report, I don't think we kept that kind of information in our lab court. I have to check with our field team, but I don't think we have done that. Okay. So,
so one user is asking, will it be possible to create a list of the email for all the user, I mean, all the attendee on today's webinar? So for this, my suggestion is you should join our Facebook, and then you can find other researchers on the Facebook, and then you can post your question research topic, and then you might attract some other interested researcher to join you. That would be a better way. Oh, yeah. So you can send out the email, and then we will invite you. Oh, there's the invitation on the bottom of the email. Yeah. So as Junko mentioned, or one user is asking whether they can have extract this data from the LASI main data set. So as Junko mentioned, the LASI main data set is not available right now. And then we hope that we are hoping it should be released like later this year. Yeah,
we are hoping soon. We are just waiting for the government approval to release the data. So as soon as we receive the approval, we should be able to release the data right away. So there is a question about any publication of dementia in indigenous population in Canada, Australia, New Zealand, Brazil, and South Africa. I do not know all the countries, except there is a study in South Africa, which is called HARSI, and I think that HARSI data is also using HCAP protocol. So I would encourage you to search the HARSI website. It's at the Harvard School of Public Health. Lisa Berkman is the PI. They interviewed the respondents in one in-depth site. And there is a question about whether there is a cap on age in LASI or LASI-DAD. No, we don't have any age cap. So we're good. All right. I think we answered all your questions. Terrific. Thanks very much for all your interest in the study. You can send any questions. You can send us an email. Great. Thank you.
Thank you. Oh, perfect.